Welcome to the Health Made Easy podcast. Health advice so easy, you'll feel more confident about your body, health, and life. And now, your host, Dr. Connie Jean.
Hi everybody. So next week I'm not going to be here and we're taking a long weekend. So obviously we're not going to be here to do the Q&A. So we're doing the Q&A today. So there are some good questions being asked. First one comes from Krish Sharma. She asks, are immune suppressants the only answer for controlling the lupus, or is there other options? And is there such thing as remission? If so, how can it be achieved? Well, immunosuppressants are the drug of choice, like the prednisones, and secondary effects to the chemotherapeutic agents too, are designed to suppress our immune system. And so, yeah, that's the main source of medications that we'll get. But sometimes we have anti-inflammatories that the doctors can prescribe, and that's mainly for pain. And then also there's the option of Plaquenil, which is a class of drugs like anti-malarial that can be used. Having said that, I've read a lot in this group about the secondary side effects to Plaquenil or various medications that are prescribed for lupus, like methotrexate. It's important to remember that there are over 60 genes to kind of break down the medications for each individual, and all of us tolerate different medications differently. And so whatever works for me may not work for you just because of the genetic disposition to break down that medication specifically. So those are the options. But what I can tell you, what we're doing here in Lupus Rebel, what I've done with my life with lupus is that I was able to successfully incorporate anti-inflammatory diets through elimination diet or the alkaline diet that I wrote to better restore my health and my cells in my body to have more of that cellular vitality, so that whatever the meds that I have to take during the times of flare, I'm better able to have a comeback and be able to fight back by having healthier cells because of the things that I do. And it's not just with the foods. And I think it's this idea of positive mindset really helps. It's something that needs to be cultivated because, as you guys know, when you're in a lot of pain and when lupus strikes hard, it's sort of really hard to kind of think outside of that negative patterning. So it really requires a lot of encouragement, support, and lots of accountability to kind of stay on track. And that's why we kind of created this Lupus Rebel group to kind of stand with each other so that we can have movement together and a tribe, or create a tribe together. So you also asked, is there such thing as a remission? Absolutely there is. So whenever your disease activity is increased, it means your immune system is overactivated. Overactivated really means dysfunction of the immune system due to various factors, right? That can be triggered by some unknown bacteria, virus, but that trigger is initiated and you become more prone to it because of substandard health levels at the cellular level. And so I always think back to talking about the leaky gut, where we are a little bit more predisposed to outside attacks from our enemies through the viruses and bacterias and the toxins that typically are okay for most individuals, but our threshold for tolerance is significantly decreased. So we get sicker faster, right? Or more frequently. And so, to be in remission is to have an anti-inflammatory diet to help support our immune system, to really boost our cellular vitality back through the diets and the exercises and then the mindsets and such that we try to promote in this group. And also sometimes you can take some various supplements that I do promote on my site to help you have that boost. So therapeutic dosages of, let's say, fish oil, 2 to 3 grams. That's probably a lot more than what most of you take. Vitamin D is another option. I found drastic improvements by utilizing curcuminoids or curcumin in a bioavailable format. I have all of that available if you were to be interested in buying it from me, but you can find that just about anywhere. So I hope that that helps. I'm going to move on to the second question. Cynthia Hildreth, you always ask the like really intriguing questions. So thank you for that. And Cynthia asks, my question is, why does doctors misdiagnose? Okay, I'm sorry. My question is, why does doctors misdiagnose lupus so much? Is lupus a new illness to the medical industry? I'm hearing a lot of people say they once were told that they had lupus and they don't anymore, and then they get cross-diagnosed to fibromyalgia, which is 2 different things. Is that right or wrong? As I always say, lupus is essentially a dysfunction. This is me answering now. As I always say, lupus is a dysfunction of our immune system. So there's a lot of various factors. So statistically speaking, autoimmune disorders are dramatically increasing since 1939. And collectively, autoimmune disease is the 3rd most cause of illness in the United States alone. It's in the US population, it's 14.5 to 23.5 million people, and that's increasing. What's really more interesting here is that it's getting harder and harder for our doctors to diagnose various different types of autoimmune conditions because there's biomarkers that we can measure, but oftentimes that kind of coincides in conjunction with the clinical presentations, which is what we call the symptoms. So it's really hard to diagnose because of such a wide array of overlap. And there's increasing numbers of autoimmune dysfunctions and the diagnoses. So anything from mixed connective tissue disorder, which overlaps with fibromyalgia, and then Sjogren's syndrome, the rheumatoid arthritis, to lupus, MS, I mean, you name it. These are conditions that are diagnosed, and it's really hard. It's not always black and white because they do sort of share the same, I guess, the umbrella. And so the better way I feel to look at autoimmune condition is to kind of look at it from an umbrella, to kind of classify them under the guise of immune dysfunction. So just think of it as your immune system gone bad. And so you have various types of symptoms, and collective symptoms are now diagnosed through the medical system to be able to have a specific medication and a diagnosis code for the insurance, policymakers and such to be able to kind of track and follow and research and all those other things. So I think we sort of tend to take this a little bit too far, and as a result, we as patients can easily get lost in the shuffle. So I hope that kind of answers your question, because even just for lupus, there's 11 types of symptoms that you must have. And then if you've got positive double-stranded DNA, for example, then you absolutely have, lupus. What I do know from a clinical standpoint, from a clinician, is that not all labs are the same. Not all normal ranges are the same. So there are definitely more intelligent differentiating biomarkers that we can track nowadays, and that's why the genetic testing and other enzymatic and food sensitivity to micronutrients, to stool testing, to hormone testing, all those things come into play to kind of better understand the overall I guess, the pattern of what you're looking at. I know that this is a very vague answer to your question, but again, lupus or autoimmune conditions are very vague. It's very gray. So I hope that that sort of helps to shed some light for you. So thank you. Next question comes from Ellen Verstraeten. I think I said that right. She asks, everyone that also have big problems with doctors, doctors who forget tests doctors who forgets to conduct certain tests, doctors who don't believe you, and they say that it's stress, that it's between your ears, and they laugh loud in your face. You get the wrong diagnoses, doctors saying different things, go to the emergency room before the doctor believes you. She says, I don't know anymore. Well, so it's becoming a little bit more common is why I think the holistic and alternative therapies are being more recognized. And you as patients and me as a patient are turning more towards the alternative care and really making sure that I have full control over my health is going to be the way of the future. And I hope you guys all recognize that, because here's the thing with Obamacare and with the third-party payers, no matter what, the doctors are trained for a course of 8 years, kind of given this time to study the dysfunction and the various disease and pathology states. They don't really know what it means to walk the line of health. I haven't met many doctors who practice what they preached. They understand the pathology so much so that they become so saturated in that alone that all they know and all they're taught is to throw medications at it. So it's really biased from that standpoint. What I do also know, the bureaucracy of the insurance carriers, it's getting out of hand. The bureaucracy, the political system, government's hand in the medical system is getting out of hand. And so therefore, now we don't have, as providers, if you take any insurance, we don't have autonomy to practice the way we need to be practicing. We're short on time. We're short on resources, and we don't get paid if we don't do procedures. So if you go to the orthopedic surgeon, they want to cut you open. If you go to the, urogyno surgeons, for example, and that's the field I'm in women's health, they want to cut you open. And that's like if you go to a specialist, they all have their procedural codes, which they have to do in order to stay afloat. And if you go to any rheumatologists, unfortunately, their biggest ammunition are the biologic drugs, such as the infusion centers are becoming really, really huge. And there's a lot of money in it because of research and the pharmaceutical companies sort of subsidizing those kinds of treatments, if you will. So unfortunately, that's where we are at. And it's not the doctor's fault necessarily, because I have a lot of doctor friends that it's sort of the way of life, it's sort of what they have to do. They have to triage their patients to make sure, one, they get paid, and two, that they cover their liability to make sure that they don't get in trouble with their credentialing body like the American Medical Association. So there's just a lot of layers to that. So what I'd recommend, Ellen, is to find another doctor. There's many good doctors out there that are kind of looking towards doing a little bit more functional medicine, paying a little bit closer attention to the patients. Often though, however, they will be out of network for them to afford the time to spend with you. And that's sort of what I've chosen to do in my practice as well, unfortunately. So that's where we are. And so I encourage you to work on your health and create health so that you don't have to subject yourself to be under the care of the medical system. So moving on. Marina Completo asks, I have both lupus and Sjogren's, and in addition to adult onset asthma and diabetes type 2. Do you know anyone that has tried NDL therapy, and or can you comment on it? The comments I've read on it seems encouraging. I am so ready to feel normal again. Not like overwhelming fatigue, or I don't like the overwhelming fatigue for over 20 hours a day. So, Marina, I'd have to say, because of the diabetes as well as your allergies or asthma, adult onset at that, I have to tell you that you probably have a mitochondrial dysfunction. It's a metabolic dysfunction as well. You've got receptors on your cells that are not able to shuffle and use the glucose or the food that you take in. Your cells are not able to use it. And so diabetes just means you've got overabundance of insulin surge in your system, but your cells, even with the surge of insulin, are not able to utilize the fuel, glucose, and drive it into our cells. And so that lag is going to create this metabolic condition to kind of take the energetic path away, is why you're feeling so fatigued. So I don't know, to be honest with you, anything about NDL, and I'm not even sure what you mean by that. So if you can clarify down in the comments below, I will see if I can get some more specific answers for you, but I don't really know what that means. But there are things that you can do. The elimination diets that's under our files in this group is really helpful. Exercise is really helpful for you to do your part in terms of eating clean, thinking clean, and also moving in ways to kind of increase energy. I know at times it's counterintuitive because you don't feel like you have enough energy to move, but actually when you exercise, it's been proven through research, lots of research, to validate that actual exercise, just a few minutes a day, is going to really improve your sense of well-being and improve your energy as well. So I hope that that helps. Next question comes from Fatima Alfonsina, and she asks, does anyone lose their voice a lot? Last month, I lost my voice for 2 weeks, and this month we're starting again. No sore throat, no fever, no chills, just poof, goes away. Well, losing your voice frequently leads me to think that it's an acute laryngitis. It's the inflammation of your vocal cords. Typically, laryngitis affects more people that use their vocal cords a lot, like singers or, actors or what have you. And sometimes when we have a viral or bacterial infection through the upper tract infection, respiratory infections, we can also lose our voice. But it can be also idiopathic like you. But you have to remember, it leads me to suspect that it's the overall systemic inflammation due to lupus that may be causing it. And so sometimes taking some good anti-inflammatory supplements may be really, really helpful for you, as well as CBD oil, curcuminoids, fish oil in therapeutic dosages might be really helpful. If you are interested in any of that, to try that out, feel free to kind of comment below so that I can send you the links for that. And I just want to make sure that I'm not leaving anybody out. And I think that's everybody. So what I wanted to say is thank you so much for such wonderful questions. I do want to let you guys know that we're launching the Reverse Lupus membership program. It's going to be live January 8th is the projected date. We are allowing 200 members to sign up for it now. We're taking payments now to reserve your spot to be part of that 200 at just $9.99 a month, $9.99 a month. You're going to get a very strategic and step-by-step approach to doing, giving you a diet plan to know exactly what to eat. I'm going to be cooking from my kitchen to give you some cooking classes. I'm going to be doing some guided meditations. We're going to give you some accountability coaching, a way for you to track your symptoms through our little app that you'll be getting access to. But more than anything, really, the $9.99 is going to help you. You're going to make that back in the discounts that you'll be getting from lupuspharmacy.com, as well as my third-party vendors that I use through functional medical practices. So all these will be paid in full with just the discounts alone, but I'm gonna over deliver because I heard you guys are all financially tight, but I wanted a way for me to share what I know about the functional medicine in a way that you guys can apply it every day. So this is going to be a very focused group of people. We're going to do a separate Facebook group. We're going to do a monthly seminar or webinar with me where I get to kind of answer your specific needs and tailor some of your programs to better suit your needs and such. So we've got so much that we're giving into this platform, and it's a way for you to support me in everything that I'm providing for you. It's a way for me to also offer functional medicine at a cost that's affordable for you. And so I hope that you guys join me in that endeavor. We've got a lot of signups already, so I encourage you to go ahead and take advantage of it as soon as possible. And we will have the links available for you in this feed, as well as you'll see various different promotions that I'll be running regarding this reverse lupus membership. So until next year, Merry Christmas to all of you. Happy holidays. Happy New Year's. I'll see you in 2018.
Thanks for listening to the Health Made Easy podcast. www.drconniejean.com